Director and panelists coming either from the countries, all the panelists and distinguished guests, ladies and gentlemen, I've been very pleased to be invited first to learn that there is such a climate and health summit. I think it was about time that such a conference was convened, but the fact that you did, I am also quite impressed with the fact that it's got quite a support that we're seeing today. I'm also pleased that my colleagues have been here to share their ideas around this particular topic, but I also must say that I think it has been a loss for me not to have been part of this whole discussion for the whole day, because there's a lot more that we would have learned out of this process, out of this discussion today. Now, we're having a number of parallel sessions that are going on at the back of the COP17, COP7 summit, which is the main one that is supposed to come with decisions on what we're going to do on the issues of climate change. But I have been amazed by the wealth of wisdom that is coming from the sessions which are on the side. This is the third one that I found to be quite interesting. The first one was the cities. It was the local government convention. A number of municipalities sitting together, looking at what they can do about this big topic. The one I've just come from is called the Climate Change Summit. It incorporates mostly the business and leaders of government, what they call subnational. That is provincial, state, or sub-state, levels of government, looking at what they are doing and what they can do. I think it's going to be very difficult for me to talk to you about climate change and health in the first instance, because all of the people who are here are experts on the subject. In reality, health basically is a sense of equilibrium between the physiology, maybe anatomy, but mainly physiology of the human being and the environment. Literally, that's all that it is. And any change in the environment is bound to have an impact on the health of humans, like it will have on the health of all the living species. And the reality, therefore, is that it is not just because you have done research. It's just straightforward, obvious that one of the areas that are going to be heavily affected is the area of health. And of course, we have had a whole, research and information about what are the likely consequences going forward. The problems of pollution are not just about what will happen in the future. A lot of you are already dealing with the impact of pollution in a number of areas. But I think what is important is how, in the past, health has played a role to deal with issues that, for economic reasons, have been taboo to debate. I think you need to just a few examples, taking you back. One of the cases that have been very strong in this country was around the impact of asbestosis, which was a huge industry that nobody could touch. And then, of course, when the doctors started talking about the frequency of the respiratory tract problems, infections, the lung cancers, particularly the mesotheliomas, and the record was not about what somebody thought of, but it was a record of what somebody has researched and is scientific and can be put in front of everybody. Then things changed. We have dealt in this country with the laws around smoking. It was a very difficult debate. I know this because when this law was piloted in this country, I was MEC, I was part of the team that was led by Nkosazana Zuma, and we went through this process. You have no idea how much politics was involved in the health or the hazards of smoking in health. It's more political than you would have thought of anything else. How many people would have gone to the other ministers, the political leaders, to just make these MECs and these ministers to understand the other side of it? It is one of the battles which today, when you look back, it looks almost normal that you can walk around here and no one is smoking as we are seated here. And when you walk around the corridor, you don't find somebody smoking and dropping their stuff on the floor. But this is one time when the health profession had gone all the way out to use the knowledge, the research, back so that it can be used for purposes of saving those who are already victims of the particular practice. The issues, therefore, of what the health profession has been able to do, not so far from here, we had a company. Some of you could remember a name called Thor Chemicals. A huge amount of destruction of lives that happened when people were actually getting exposed to very heavy metals, buggering their kidneys and everything. And it was a huge investment on the side, and everybody was happy that there were jobs and everything. What is the big problem with the discussions and negotiations on the climate change? It's the politics of profit. That is where the issue comes back to. The politics of profit is serious because it's not only about money, but it's also about political positions. And the reason why that's an issue, it's actually going to be, I mean, I was just listening as Kumu was talking. A number of things that are going to come out at the end of these negotiations may not surprise many of us, because we have already been hearing these sounds that there are certain areas of inhibitions in moving forward in certain areas. It's not now, it's not new, it's happened in the past. But the bottom line on this issue is that between the huge multinational corporations and the national governments, there's a particular balance there that is a problem in taking certain decisions. You will never find that most of the countries that will find it difficult to move forward are not doing so simply because of the politics of the voters. They are doing so because of the politics of business. And at the end of the day, this is what we need to really understand about the problem that we're dealing with. But having said so, I've come from another discussion that I just spoke about. When we move forward and want to deal with the issue of climate change and health, for us it is logical that we are going to find that the increase in temperature is likely to then, because of the changing general changing temperatures on the surface, you're going to be seeing a change in the disease pattern, your chest respiratory tract infection, your gastrointestinal tract problems, infections, and so on, your skin cancers, all the other are going to be actually on the increase. Your floods are going to be causing all of these problems. You've got on the one side the diarrheal diseases, the malaria on the other side, and so on. We just had a huge problem to deal with here. which of course creates some of the contradictions. When we deal with malaria, with the movement, south migration of Anopheles species of mosquitoes that had already been eliminated and that it moved over, and then we had a huge problem. This problem is going to actually recur in areas where some of the diseases have been completely controlled. But it doesn't only deal with the diseases that are affecting humans, but animals. The livestock is going to be similarly affected. The tick-borne diseases, the vegetation are going to be all part of this. So this aspect is pretty straightforward. It's general knowledge to the health profession. It is straightforward. The issues that I believe are important. One of those is, to what extent do we use what could be general knowledge amongst the health sector? To what extent do we use the research which we can easily understand in a manner that begins to make an input in this debate, that begins to therefore shift the discussion from the concern about a particular company's performance because of the nature of the carbon emissions, to actually deal with what is the impact on the human beings in any particular area. And I think the point that is important here is to see yourself as a health profession as the resource that will make it possible for arguments to begin to change, for the debate not to be focusing only on the basis of emissions, then focus on the issues of the survival of particular companies, but it must focus on